So what's it like going in for surgery? Well, I can tell you it's not fun. It's not bad. It's just an experience. It all goes great up until when you have the surgery. And then afterwards is that road to recovery, which is key. And that, of course, will be another part in this series. But going for surgery, it kind of almost goes like you had something planned to do one day and somebody calls you and needs something and your entire day is sidetracked. You had to go and make a detour and go help them out or whatever happened or something. It's just like an upset in your day. It's not a major upset like your water heater exploded or something like that where it's like a fucking disaster. It's just like a big inconvenience in your day. Like Monday seemed like it was going to be just like Sunday, laying around waiting and then surgery. Okay, it's surgery, but as soon as that hit, it was like this major upset bump in the road. And that was that. So now I have to go and get into a stretcher. They said, can you get from your bed out to the hall to get into the stretcher? I said, yeah, I can get up and walk, sure. I didn't have the surgery yet, so I got up and walked over to the stretcher and laid down on it, and that was it. It's this point I was perfectly fine, except for still having the pain in that and being on those pain meds that they were pushing through the IV. So anyways, now they take me down for surgery. So they take me down the hall. They got me through the breezeway, which is where the breezeway video came from later that day. And they put me in the elevator. They take me down to the operating room. And I go out there, and they wheel me in, and there's these big stainless steel doors. And on the doors, big signs, operating room, do not enter, sterile environment. And you're seeing like all the shit you may have seen in the movies and that, where the surgeons are like washing up and holding their hands up like this and that. Although you didn't see the surgeons and all of that, it was like, oh wow, this is really like what you saw in the movies. It was like really strange. Well, anyway, I get down there, and there's a little coffee clutch of doctors there. And one of them comes up to me, and she says that she is going to be the anesthesiologist for the entire operation. She's the one that gives you the anesthesia, obviously, for those of you who aren't big on the English language. So anyways, I don't know what nationality she was, but she had a very interesting speech pattern or tone of voice or something. Everything she said ended on a high note. In other words, like, let's just say this were a regular person and she was your mother and you got a paper cut. And, you know, she would tell you, oh, you should put a Band-Aid on that. She wouldn't say it that way. She would say, you should put a Band-Aid on that. Everything like ended in this high note kind of weird inflection. Very strange, very weird lady, but apparently she knew her shit. Okay, so I met her. And now I go down there, and there's a whole coffee clutch of doctors. So I met her, and then the other doctor says, hi, I'm the doctor who's going to be doing the surgery. How you doing? Good. What are you here for? Now, I know why they asked me this, like just to make sure my mental status was good. But it's also kind of funny. It's like, well, my ass decided to drop in for a milkshake. I decided I'd come along. You know, what do you want me to say, really? I'm here to get my fucking gallbladder out. What am I here for? Anyway, so I get a gallbladder out. Okay, good. Yeah, all right. So I'm going to be doing the surgery, and my partner, who hasn't gotten here yet, will be finishing up. In other words, I'm doing the surgery, and he's going to kind of button you back up. Okay, fine, whatever, no problem. And I met that guy earlier in the day on Sunday, or actually the day before on Sunday. He came up to the room and checked in with me and that. So that was all fine and good. So now, now's where it gets interesting. Well, it's almost at the interesting part, but it was kind of a fun little interlude in the interim. So there's a lot of inter in there, but of course that's irrelevant, as XJO81X would say. The doctor looks at the chart and he says, this says that you need an EKG. And literally, this is how the guy, I swear he used these words. He said, why the fuck would they want an EKG on this guy? He's 36. He's in reasonably good health. The fuck do they want an EKG? Who the fuck wanted an EKG on this? I want to bring him right in. And the nurses said, well, doctor, it says that he needs an EKG first. It's like, what? Take him for an EKG. And he like got flustered with this. It was like, shit, I don't want him on my bad side. I didn't ask for it, you know, whatever. But I guess they settled out on the back end. Now they wheel me in down the hall for an EKG. They take me in there. Now for surgery, you got to take out and get rid of any kind of eyeglasses, dentures, hearing aids, rings that you may have on your fingers. If you have like an eye ring or an ear ring or a nose ring or a dick ring, any of those things, Prince Albert's especially, got to come out. So anyways, the problem with me, and you can't really see it on this finger here, I have a ring I keep on that. You can see a little line there. But this hand here is where the wedding ring is. And you can definitely see where the ring was. Well, they all wanted to cut the ring off. Now, if you're asking, why is that so bad, Jay? Why is it so tight? Why do you have that mark on your hand? That's not good. What happens is you get married, they put a ring on your finger, then you get fat. Then you can't get it off. And that's what happened. It's been 10 years, so it's stuck on there. I think they do that purposely. Not sure on that, but I'm sure a lot of you other guys out there have experienced something like that, and he'll agree with me on that. Anyways, they're saying, oh, I don't know about that. We can try to tape it down. No, you can't tape that down. That's got to come off. We're going to have to cut that off. We're going to have to remove that. We should just amputate his damn finger. No, it didn't go that far. But I said, okay, guys, hold on. Patient rights here. Get me some hand lotion. Get me a paper towel. Put the stretcher up. And give me 1 minute of your time. So they stop what they're doing. They run off. They get some hand lotion. They get the paper towel. They get everything ready. And I put some lotion on there. I work it around. And I just work the ring off. Just, you know, wiggle it. Try. It's hard. It's just, you know, grating your teeth a little bit. It's trying to pull it. Get the ring off. And there you go. There's the ring you wanted, okay? That wasn't so hard. Meanwhile, they did the EKG already. And now there's a lady on the side of the bed right by me, kind of over here, wheeling the bed on the side. Somebody behind pushing it, I think a person on the other side. And I didn't pay attention to these other two people. But this lady here was like being really nice to me. And the funny thing is she looked and sounded a little like Linda Lavin. So it's like, oh God, it's Linda Lavin. Wow. And she says, you know, I had the same problem with my ring. She says, I suggest that after you're all done with the surgery and you recover, that you go on a diet. Screw it, just get the ring resized. So then I laughed because she was, you know, it was kind of like the funny aspect of it where, you know, the proper thing to do is go on a diet, but you know you're never going to do that. So just get the ring resized. And then she had the same problem. So they wheel me into the operating room. So now in the operating room. Now we'll stop again. I'll make a separate video on that.